Good morning, everyone. My name is Oscar Llorente. I'm the Director of Network Development and Community Relations at Mount Sinai Medical Center. We're here on Facebook Live with the city of Sunny Isles Beach, partner that we always have these lectures. And today we're going to introduce a cardiologist talking on women's health and heart disease. Dr. Maria Salas has joined us at Mount Sinai in Aventura and in Sunny Isles. So with that, I'll turn it over to Dr. Salas so she can give a presentation on women's heart disease. Thank you.
Hi, Oscar. Thank you so much for the introduction. As you say, my name is Maria Salas, and I'm working here at Sunny Isles and Aventura. And today I'm going to start sharing my screen here. And we're going to talk about the... Try to make it bigger.
There you go. Perfect.
You can see it? Yeah.
Yes.
So this month is the month of the heart health, and also for women's, the Red Day for women's heart conditions. And I want to talk to you about the risk factors for women and to make awareness of those risk factors, and also how can we prevent some of the cardiovascular disease in women. So the objectives of the talk are going to be definition of heart disease, the incidence of heart disease in women, risk factors that are unique to women, and also risk factors that are common with men, and lifestyle modifications that we can do to prevent these occurrences, and also prevention, and as I said before, awareness of cardiovascular disease in women. So first of all, it would be nice to define what is heart disease, or known as cardiovascular disease. So coronary heart implies different systems in the heart and related to the heart and the vessels. So we usually talk about cardiovascular disease referring to the coronary heart disease, which is the arteries of the heart, that they can be showing up as a myocardial infarction or angina, which is chest pain, or death, coronary death. Another type of cardiovascular presentation is what we call heart failure. And heart failure is defined as like the failure of the pump. The heart is a pump, and usually when it starts to be weakened for usually a heart attack, or sometimes from infectious conditions, like now with COVID infection, we've seen a lot of myocarditis can showing up or be as a first symptom in a person with a failure of the heart, a systolic failure, like the pump just get weak. Also, there is another type of heart failure when the heart is not really weak, but it gets maybe stiff. So the function of the heart still preserved, but then the compliance of the heart, the way that the heart relaxes to get more blood, is impaired. So the pump is still not working optimally. Another cardiovascular disease, or another example, is the cerebrovascular disease. When we talk about stroke or transient ischemic attack, which sometimes people define as mini strokes. And these are like debilitating symptoms that happen within few hours and resolve usually within 24 hours. And these are also related to the cardiovascular system. And the one that maybe we don't pay too much attention as patients is maybe the peripheral artery disease, or when you have insufficiency of the perfusion in the arteries of your legs. So you're having pain when you walk, you have to walk for a couple of blocks and then you have to stop because you have this pain in the back of your legs that is kind of representing claudication or problems with insufficiency of perfusion in the arteries of your legs. And actually, a third of those people that will have a peripheral artery disease will be also having problems with their heart, with the coronary arteries, with the carotid arteries, or having events as a stroke or a heart attack. Also in the peripheral artery disease, we have to mention the aortic aneurysms, or aneurysms in the brain, or all the other types of vascular conditions that can be related to the heart and the cardiovascular system. So the incidence is the incidence of cardiovascular conditions that produce death that kill women is very high. It's the #1 killer of women and also the #1 killer in men. The mortality has declined in the last 40 years. This has been proven in a study that was done actually with nurses. 85,000 nurses were evaluated and follow up for 15 years. And they show that in the around the 2000s, the incidence of cardiovascular disease and death for women, young women, was reduced due to the reduction of smoking. So the smoking cessation reduced like 41%, and the mortality in women and young women plateau. But also there was an incidence of increasing overweight in women. So that's another problem that we have as a risk factor. So there was one for another one. So let's talk about the risk factors associated with the cardiovascular disease. One is the personal history of coronary heart disease, if you have peripheral vascular disease, or as I say, cerebrovascular disease. If you are over 55 years old, if you have family history of premature coronary artery disease, meaning a relative like a male under 55-year-old that had a cardiovascular event, that's, as I mentioned before to you, those cardiovascular events of the heart or the arteries or the stroke, and a female under 65. So if you have a relative with these characteristics, you will be having a risk factor for cardiovascular disease. Another one known is the hypertension, hyperlipidemia, diabetes, metabolic syndrome, which is pretty much a conglomeration of symptoms or characteristics, or is a syndrome as the definition says, high glucose, high blood pressure, obesity, mostly in the waist for women and men. And I'll tell you in advance what is the characteristic of the type of obesity and metabolic syndrome. And also low good cholesterol, the HDL, or high triglycerides. So those are the characteristics of the metabolic syndrome, and it's one of the risk factors for cardiovascular disease. Chronic kidney disease, smoking, well known, postmenopausal, psychological stress, depression and PTSD, inflammatory rheumatic diseases, pregnancy related complications, and I'm gonna go in each of them, obesity and sedentary lifestyle. So risk factors that are unique to women. These are probably not known for everybody, but the early menarche, when a person has the menarche in the age around less than 10 or 10 years old, that increases the incidence of mortality. So if you have it for 1 year that you have increase in the menarche, let's say 11, 12 to 13, 13 will be the kind of a normality, will reduce your mortality risk by 3%. The menopause or early menopause, when women had menopause before the age 44, they have increase of risk of cardiovascular events. When there was a study that showed that women that had menopause before age of 40, they will have a 7.6% increase in risk of cardiovascular events within 10 years. So these are unique risk factors to women. I'm going to show you here this is a plot of the Kaplan-Meier graph showing how in this study, the Women's Health Initiative, which is one of the biggest studies that show that hormone therapy in women wasn't of help for the cardiovascular events. So the hormone therapy of estrogens and progesterone compared to placebo meaning no intervention or no medication provided to these patients, show that the people that were on estrogens and progesterone would have a higher increase of coronary events and coronary death. This is the incidence of myocardial infarction, and I want to show you how the difference or disparity is between men and women. So men usually have more cardiovascular events in the young ages, yeah, when they are 35 to 45, they start to have more incidence of cardiovascular events compared to women where we are really dormant. We start to have more problems when we turn 55, which is pretty much the postmenopausal era, and also associated with our age. Yeah, getting older makes us having a higher risk of having cardiovascular disease, cardiovascular events and disease. So anyhow, the men are always a little bit higher than us in the incidence of cardiovascular events, but nevertheless, remember cardiovascular disease is #1 killer in women too. So as I said, the risk factors unique to women, we say the early menarche, the menopause, and this one, the premenstrual syndrome. So people that are known to have this maybe mood swings or like depression, migraines associated with prior to coming with the menstrual period, they will have a higher incidence of having high blood pressure long term. So there is a 3.3 increased risk of women of developing hypertension when they have PMS or premenstrual syndrome. Also, the oral contraceptives. It's not that you cannot take oral contraceptives when you're young age, but when they're people that are older than 40, they have been increase of incidence of risk of myocardial infarction and stroke when you take oral contraceptives, showing in the graphic before. So let's talk about the pregnancy complications. And these are also, I don't think everybody will know about this, but the preeclampsia will have 2 times more risk of develop cardiovascular disease in the future when you develop high blood pressure in pregnancy, and also when you develop diabetes mellitus in pregnancy. So kind of high risk pregnancy females that will develop this type of conditions will have more incidence or propensity to develop hypertension and cardiovascular events when they are older. Also miscarriages, spontaneous pregnancy loss, or preterm birth, people that deliver babies before 37 weeks, they have also associated showing problems with cardiovascular disease in the future. So what are the risk factors common to men with men? Sorry, with women and men. So age, the family history of premature coronary artery disease, hypertension, which these are kind of like the prior guidelines that show the high blood pressure, the normality would be up to 130/80. But nowadays in the last guidelines show up that the blood pressure that we're trying to look for, the target would be below 120/80. Hyperlipidemia, when you have the good cholesterol, what we call high density lipoprotein is low. So that's kind of like a non-protective factor. Lipoprotein little a is also an independent predictive factor to develop cardiovascular disease in men and women. And total cholesterol, which is, I mean, usually the normal limit is 200, but when it's the one that is associated in women, more than 265 milligrams of deciliter, that will be the higher risk for cardiovascular events, the same as the triglycerides, which more than 400 milligrams have shown to progress to have a risk factor for cardiovascular events in women. Diabetes mellitus, chronic kidney disease, and metabolic syndrome, as I mentioned to you before. So this is a graphic showing how the prevalence of hypertension in the United States is. This is actually from 2010, kind of a little old, but this is the last showing up the difference between the ethnicity and male and women, and the ones that the non-Hispanic ones, the white non-Hispanic have a lower incidence, but the African American ones that have a higher incidence in men and women for high blood pressure, followed by the Hispanics or Mexican Americans that had high blood pressure after 60 years old. Remember that a person after 60 years old, no, independent of the sex, a third of the people, 1 in 3 people, will have high blood pressure problems. So what are the lifestyle factors that we can modify and we can always like remove as a risk factor from our lives? One is to stop smoking. Yeah, cigarettes produce a high risk of coronary vascular disease. When you stop smoking, even if you smoke for women, even if you smoke to 1 cigarette to 3 cigarettes a day, you're having a higher incidence of cardiovascular events. It has seen that the people that stop smoking, probably they reduce to the same type of level as a person that doesn't smoke after 3 years of stop smoking. So even if you stop to smoke today, we'll have to wait 3 years to really be on the same level of the person that never smoked, to decrease that as the same as the cardiovascular risk factors. The other very important, and this is something that I really emphasize with my patients, is the diet. And there are many descriptions of types of diet that have been associated with decrease in the cardiovascular events. One of them is the Mediterranean diet. Another one, the plant-based diet, the Ornish plan. Another one is the DASH diet, which helps more with the low sodium in hypertension. I just want to talk bases with you about this Mediterranean diet because I think it's one of the most doable diets that we can find to decrease the cardiovascular risk factors. So notice that there is a pyramid, yeah, because the things that you do more are the ones, the base of the pyramid. So emphasizing here in activity, yeah, you have to have more than 2.5 hours per week of activity, meaning 30 minutes a day for 5 days, or maybe 45 minutes 3 times a week of aerobic or very active exercise that will make your heart strain. Yeah, so those are the type of activities you want to do. The other basic thing is how you're gonna base your diet. You're gonna base your diet in vegetables, fruits. You see here avocado, which has high density lipoprotein, type of the good fats. The nuts, the almonds, walnuts, those are the good kind of snacks to have. Also the whole grain breads, herbs, spices. There is no dressing here. Yeah, the only dressing you should be using to anything is olive oil, and be fine with that. That there's no really, olive oil can really replace any mayonnaise or anything that you're using really in your diet, based on all these other foods that you can take on a daily basis. Then if you try to get some protein from animals, the one that recommended most is fish, yeah, and will be the dark meat fish, or like shrimps, all this type of seafood that you can find. And less, or the least one, you want to do poultry or turkey or dairy products, because they have been associated with less decrease in the cardiovascular disease. And least once a month, I always tell my patient, maybe once a month, when you go to a nice restaurant, maybe get a steak or maybe get an ice cream, but something that really you shouldn't be doing at all as a routine basis. Notice here wine, which is an antioxidant and is well known to have some anti-inflammatory properties. So that's one that we can take, and also plenty of water. Well, so we're going to talk here about how the obesity impacts our cardiovascular risk. So when a person has a BMI, which is a body mass index of more than 30, and we try to see at the distribution of the fatness. So if the fat is in the middle, in the waist, like we call the apple shape, waist for women in more than 35 inches, or the waist of male more than 40 inches, which is one of the criteria to have metabolic syndrome, that will increase the cardiovascular risk. Better to have a type of a pear-shaped obesity, which has less incidence of cardiovascular disease. Alcohol intake. So as I said before, the red wine is kind of antioxidant. Is up to 2 glasses of wine per day per male, so is a good thing, or is that the standardized recommendation. But remember that the excess of alcohol in women has been associated with breast cancer, so that's something that we have to pay attention to. Women, the incidence of breast cancer is higher, and then the alcohol intake should be 1 to 2 glasses and no more per day. a sedentary lifestyle. As I said, we have to move, we have to walk, we have to have a routine. We have to really, when always comes to when I ask to the patients, like, what do you do as activity? Oh, I keep working all day. I'm very busy. But the reality is that those jobs are really, like, I can say I'm busy too, but I'm sitting all day in a desk. Maybe I'm walking a little bit from a bathroom to a very short distance, but I'm not really doing anything active. I'm not having a routine of exercise. So the message here is to really have establish a routine, establish a time that you're gonna say every morning or maybe every late afternoon, I'm gonna go for a brisk walking. Maybe I'm gonna go walking for 20 minutes, maybe 30 minutes, 5 days a week. That will make me having my heart rate goes fast and my cardiovascular risk is gonna decrease. So really we have to establish a routine and make time for the routine. That's very, very important. Psychosocial factors, women that had depression or PTSD, it has been increase of the incidence of cardiovascular events. So this is really, really one of the most maybe underestimated and not really paying attention to the women's feelings about depression or anxiety or these factors that can really influence your cardiovascular health. And other types of things that we have seen that influence the cardiovascular risk factors are the inflammatory markers, like CRP is an independent factor. You usually check it because the high sensitive CRP has been associated with people having more events in 10 years. Albuminuria, which is a protein that you see in the urine that has been also associated with high risk. Problems with hypercoagulable states or rheumatological diseases like rheumatoid arthritis have increase of the incidence of coronary events because of the arteries are also changing those type of diseases. Hypermuscymia, another one of the factors that influence, and these are related to both men and women. So the most important thing to prevent and actually to make aware people on the cardiovascular disease conditions is that women after being 20, since 20, they should start going a cardiovascular assessment at least every 3 to 5 years, checking their cholesterol at least one time to make sure they don't have that hyperlipidemia or problem, familiar hyperlipidemia that sometimes people show up with. High blood pressure. Yeah, the incidence of high blood pressure in women have been increasing in people before 40 years old. So that's something that we have to really pay attention to. Identify cardiovascular risk factors, as I say, the family, the history of the family, diabetes, chronic kidney disease, all those things that you can find really with one time follow up with the primary care physician or with the cardiologist, but that's something that you really have to establish if you have risk factors or not to develop cardiovascular disease in the future. And the most important is to talk to a doctor, or if you have any questions, or if you really don't understand, maybe you have a family or a member that had a problem, sudden cardiac death, and you really don't know if maybe something that you have to worry about. Those are some things that you have to discuss with the doctor, and also for them to find if there is any modifiable risk factor that you may have that can be treated early, so before you develop any cardiovascular event. And with that, I think I'm gonna leave some time for questions, if that's okay.
Hi, Dr. Salas, can you hear me?
Yeah, I can hear you.
Perfect. So yes, we do have some questions for you. I have someone whose spouse takes a daily aspirin, and she's asking, should she take a daily aspirin as well? They're in their 70s.
So yeah, there was but a couple of years ago, they come up with the recommendation really downloaded to be of having aspirin after 75 years old. So there is no really recommendation anymore for people older than 75 to take a daily aspirin. This is because of the higher risk of bleeding. Yeah, and aspirin will produce some gas. It's sensitive to the stomach. You can have more high incidence of bleeding at long term when you're older. and maybe the benefit of having aspirin after that age is not going to be, you're not going to see it pretty much. So we do keep aspirin on people that have high risk factors for cardiovascular disease or are known to have cardiovascular disease. So it's really depending on each person nowadays for the aspirin, and it's a unique, it's not like before that we used to recommend to everybody. No, now we have to really pay attention at the risk factors, at the core cardiovascular conditions to really recommend aspirin or not to a patient.
Okay, great. So I have someone else that you mentioned about family medical history. How can I find out about what my family medical history is and how does it affect me?
So family history, on what we said is that if you have a relative that is a female, let's say your mother is less than 65 when she had a heart attack or she had a stroke, that puts you at risk of having a cardiovascular event yourself. If you have your father or maybe a grandparent that is a grandfather, I'm sorry, it has to be male, which is he had an event less than 55, let's say, or a brother that you had a brother that had a heart attack in their 40s, below 55, that's a cardiovascular risk factor for you. So that's something that you have to tell your doctor when you show up to the visit, like a routine visit, to make sure they can check your cholesterol and other modifiable risk factors that it may propensity for you to have a cardiovascular event in the future. So that's how it affects you.
Okay. All right. I have a couple of other questions. One of them is, does high blood pressure have an impact on me getting a COVID vaccine?
That's a tricky one. So the vaccine hasn't shown any contraindications. There is no, if you go to the CDC website, there is no really contraindication for you or for anybody to have the vaccine. And actually, I haven't heard of any related hypertensive complications related to vaccine. So I think it's really safe to have the vaccine when you have high blood pressure. I mean, if you're controlled, obviously. The big contraindication for the vaccines are people that have like allergic reactions or known to have problems before with other vaccinations. So are really the contraindications. And remember that with coronavirus, hypertension is actually one of the risk factors to have a more morbid infection with COVID. So you want to have people that have hypertension or COPD really vaccinated, so they don't have really a bad course of disease if they happen to be infected.
Okay. And then I have, I'm a younger woman, physically fit. Do I really need to worry about heart disease at this time?
Well, depends on how young. As I said, the awareness for women, we should start at least on our 20s to check at least with a primary care physician. You have to have at least one time your cholesterol panel. You still have to, if you have history of somebody with diabetes at home, you have to have a hemoglobin A1C check for you. So those are modifiable risk factors that definitely you should be able to tell only one time visit. I mean, if you're in your 30s or below 40s, that's when you really have to have at least one time that visit to make sure to establish care and to make sure you don't have any problems that may be a future risk factor for cardiovascular disease. And if you're doing exercise, that's excellent. Really, the recommendations for anybody that is young is just doing exercise, have a healthy diet, try to keep up with what I say, the lipid panel at least one time, and hemoglobin A1C to make sure you don't have any problems with that. And then that's it. Keep your good lifestyle and non-smoking, obviously.
Obviously. One last question. What are the symptoms of a heart attack in women? Are they the same for men and women?
Yeah, so that's known that the women, we don't have the same problems as men. When we don't present with the typical angina symptom. We don't present with a typical chest pain or like radiated to the left arm, or that women, we sometimes present with maybe an indigestion, maybe sometimes jaw pain. I've seen a lot of jaw pain, neck pain in women. Sometimes it's just headache, shortness of breath, but we don't really have that characteristic chest pain that present with men. We have more in a specific symptoms. So nausea, vomiting, that could be a heart attack in women.
Well, great. Thank you very much. Very informative. And we really appreciate your time, Dr. Salas. Again, Dr. Salas has a practice in Aventura as well as in Sunny Isles at Mount Sinai Medical Center. So if you would like to visit her or talk to her, you can go onto our website at msmc.com, and you can either schedule an appointment or call our offices. I also would like to take this opportunity to thank the fine people at Sunny Isles Beach, the city of Sunny Isles Beach, for bringing us this presentation, and we look forward to more presentations in the future. Everybody be safe and be well, and we look forward to seeing you very soon. Thank you very much.
Thank you, Oscar. Thanks. Bye-bye.
Bye-bye.